So the CALYPSO trial was a Phase II trial. It was in VEGF-pretreated patients. It was in a time where the VEGF was the standard of care therapy for first line. We enrolled 139 patients in the clear cell cohort, and we randomized them across the 4 different arms. It was Durvalumab, Durvalumab plus Tremelimumab, Durvalumab plus Savolitinib, and Savolitinib. The Savolitinib arm was closed early due to a lack of efficacy. The primary endpoint was confirmed response rates above 50%. So what we presented yesterday was the final analysis, and with a minimum follow-up of 40 months, we showed that the Durvalumab plus Tremelimumab arm had significantly higher response rates compared to Durvalumab alone, with a p-value of 0.026. And then the Durvalumab plus Savolitinib arm did not do much better than the Durvalumab alone. And when we looked at the med-driven tumors, we did not find any enrichment. We also presented the final PFS and the final OS with a minimum follow-up of 40 months. We didn't show any clear benefit despite the higher response rates, probably because our population was too small. And then we presented exploratory analysis, exploratory biomarker analysis. We measure PD-L1 in the above 100 of patients. We used the tumor cell staining and CPS. And when we looked at the PD-L1 positive population in both approaches, we didn't find any enrichment in response in the Durvalumab plus Tremelimumab arm or in the other arms. We also measured KIM-1 using the standard procedure, and we measured KIM-1 at baseline and after a median of 12 weeks of therapy. We showed that KIM-1 at baseline was prognostic, and we showed also that among responders, the drop in KIM-1 was highest, was statistically significant, and the biggest reduction was seen in the Durvalumab plus Tremelimumab arm.